And that would be amazing. So tonight we're going to do, we typically start off with a medical presentation about the benefits of kidney transplant. I'm sure many people on the call are aware of them already, but we do like to do just a quick, there's certainly some folks who are probably new to their transplant journey, for lack of a better word. And so we want to just go over a little bit of that. I did have a healthcare provider queued up to speak, but at the last minute, was unable to join us. So I'm going to try to do her slides justice if I can. And then we'll move quickly into the panel, which is really the best part of the evening. You get to hear from our ambassadors who are going to share their unique stories about being recipients and donors through the transplant experience. So I think it'll be a great evening. I know some of you have joined us before, so thanks for coming back to see us again. I'm going to share my screen. Give me 1 second. Okay, can you see my screen? Yeah. Okay, perfect. View the lobby. Someone else, someone's trying to get in here. Let me just, sorry. Okay. All right. So thank you again. Just want to acknowledge Sharon Sheard from RVH, who was kind enough to develop these overview slides for us. I will not be able to answer any medical questions about them, but there are a few other healthcare providers who should be joining us tonight. So perhaps they can answer anything that gets a bit too medical for us as kidney patients and donors. So in terms of survival rate, transplant offers a better survival rate than dialysis. The average survival rate on dialysis is 5 to 10 years. For recipients who receive a deceased donor kidney, survival rate at 5 years is 82%. So that's an average of 10 to 12 years. And living kidney, if you have a living kidney donor, survival rate at 5 years is 90%, or an average of 15 to 18 years. So you can see that there's great benefit from pursuing the transplant option. And if you have an opportunity to also seek and find a living donor. There are only 3 treatments for kidney transplant, for end-stage kidney failure. One is a transplant from a deceased or living donor, as we just discussed. The other is peritoneal dialysis or hemodialysis, which you can do in center or at one of the satellite centers or at home. Transplant is the best treatment option, but it is not a cure, and it's not for everyone. But we do hope that you get to ask all of the questions that you want to ask. That you get to find out if you are eligible, that you get to understand whether you're being worked up or not, and that all comes from asking as many questions as you need to get the answers that you need. There are exclusion criteria that is considered in terms of your eligibility for transplant and the surgery, and that would include, some of what they call comorbidities, such as active malignancy, an active infection, drug abuse, or uncontrolled psychiatric disease. So some of these things, such as a previous cancer diagnosis, depending on what type of cancer it is, they often will consider you 2 years after you've got through your cancer treatment and things like that, and nothing's come out again. So if you are excluded or if you're ineligible, that could be temporary. So it's always good to find out if it's temporary, that it's something temporary or something you can do something about, such as, you just have to wait a period of time, or maybe you need to reduce your BMI, etc. So there's lots of reasons why it may just be something that you have to wait a little bit longer for. If a patient expresses an interest in transplant, they're referred to a transplant center. If you're not being seen at a transplant center, there's only 6 transplant centers in Ontario. So if you're at one of the other 21 renal centers, then you'll be referred to another center. So RVH, for example, Royal Victoria Hospital in Barrie, refers to Toronto for to either St. Mike's or UHN for transplant. So the benefits of kidney transplant beyond the increased life expectancy that we already discussed: greater quality of life, increased energy, not having to be on dialysis, and fewer dietary and fluid restrictions. So again, this is our medical slide. I think our ambassadors will provide a lot more color to some of the benefits of transplant that they've experienced. So in terms of transplant options, you could have a living donor that would give directly to you. It could be a deceased donor transplant that you're waiting on the deceased list to receive your transplant. It could be through paired donor exchange if your donor is not a match for you. It could be an anonymous donation that you receive from someone who wants to give to someone and you don't actually know who it is. And you could be an ABO incompatible donor. So there are some programs that will actually look at an incompatible donor, and they could potentially do some tests, and there is some special treatment that they can do. I think this is something that you have to look into. I'm hoping that somebody's able to let those folks in when they're in the lobby. Is someone able to do that? Anybody letting them in? Okay. I'm hoping so. So the benefits of a living donor transplant, which we already discussed, in terms of a slightly longer life expectancy. You may be able to avoid dialysis if you have a living donor. You may be able to get worked up before you actually need dialysis, and that's called a preemptive transplant. The transplant typically lasts longer as well. The avoided stress of the waiting list and waiting for that call that could come at any time. Also, the kidney tends to work right away with the living donor. During the surgery, it starts to work for many people, and is certainly seen as the gift of life in very literal terms. So the deceased donor challenges, and again, these are the medical slides. So from the perspective of one of the renal nurses, is the wait time, which is anywhere from 4 to 10 years currently for a deceased donor, depending on your blood type. If you're blood type O, you're waiting the longest, unfortunately. You will probably need to start dialysis before you get put on the deceased donor list. The longer you're on dialysis, you can develop some complications that might make you less likely to get a kidney, or maybe potentially exclude you due to complications. You may be called the last minute to receive a transplant, and certainly there are lots of stories of people who are called and arrive at the transplant center to find out that the kidney is actually not suitable for them. So that's just some of the challenges of waiting for the deceased kidney donor. So I believe this is the last medical slide, which is good because I'm sure I'm not doing it justice. But transplant is the light at the end of the tunnel for many patients. And we just need to keep our eyes on that prize, be positive, be optimistic, and you'll hear more about that from our ambassadors. Keeping patients as healthy as we can for the renal nurses and the renal staff is their goal until the transplant opportunity presents itself. So I'm going to just go very quickly into a little bit about our transplant ambassador program. All of you on the call, or many of you on the call, are in the midst of kidney decline or potentially kidney failure. And so we're here to let you know that as it was the case for us who have gone through what you're going through now, one day you'll tell your story of how you've overcome what you're going through now. And it'll become part of someone else's survival guide, just like the stories that you're going to hear from us today. And so we're happy to, that's part of the reason why we like to share these stories with you, because we truly know how you feel. This was a quote by Brene Brown, so I didn't make it up or write it on the sidewalk, but it's something that we've kind of taken on as a bit of our mantra within TAP. We are all kidney.
Right, Stu.
Yeah.
I think you might have to let people in because I don't see an option of doing that. So
Okay. Let me exit out of this then. Just 1 second. Okay. Thank you, Bill. Appreciate that. I wasn't sure if people were going to be. Thank you for that. It's part of the challenge, letting people in and presenting at the same time. Okay, excuse me. Apologies. Now I'm getting a tickle in my throat. This is one of those things. Okay, apologies if you're waiting in the lobby for a little while. We're very happy that you're here with us now. I was just sharing a few slides, and I'm just going to go back to them really quickly. It'll only take me a minute. Just to let you know, just a couple of quick things I wanted to point out about our program. I'll skip that one. If you haven't gone to our Transplant Ambassador website, please do that. There's lots of information there, and we're updating it all the time. Especially like you to notice our Transplant Ambassador directory, which is in the top right-hand corner of our homepage. Please check it out. This is actually what the directory looks like. You can click on any of these colored tiles or a combination of them. So you could click on kidney transplant recipient who was over 65 at the time of their surgery, and that would run up a list of, I don't know, 30 or so folks who had their transplant over 65. And then you could see their story if they have the red here, or you can send them an email that would go directly to Transplant Ambassador email. So please check that out. It's definitely worth having a look and hopefully finding somebody that has a very similar story to you. Also on our website, in the middle here, right here with the black patient seeking donors, it's the bar on the left. You can go online and put in some information to create a profile for yourself. So this is Melissa's profile. We have between 150 and 200 profiles now on this site called Patient Seeking Donors. The great thing about it is, as you can see here, which is why I wanted to share Melissa's profile, is you don't have to provide any personal information. You can communicate. Someone can reach out to you through our website, and they won't have any of your contact information unless you choose to give it to them. You can put your contact information on the site, but you don't have to, and most of the people don't. You also get an URL that is not showing up here very good, but Melissa gets her own URL, and she can actually send that exact link to this page to all of her family and friends and let them know what she's going through and that she's looking for a kidney. And we have had so some of the people that have gone on there have used this as a great tool to let their extended networks know. And in some cases, just letting people know that this is where they're at, even though they think people understand where they're at. You know, people are busy, they have their own lives. And so in some cases, some of the people who are on the site have had a number of people reach out to them to say, hey, I had no idea this is where you were at. I'm happy to do what I can. Let me know what I can do. So it's great from that perspective. We also have had some other donors, non-related donors, use the site to reach out to people as well. We have a lot of resources on our resource hub. Have a look at that. We will record this webinar and it will be we now have about 20 on our website, so you can go back and look at this later. It'll take about a week for us to get it up there. We'll also email it to everybody who registered, but you can also scroll back and look at all of our past webinars. And that's it. We just want to put in a plug for our Transplant First advocacy campaign. You can go to transplantfirst.ca excuse me, and see more about it. So as a group of transplant recipients and donors, we're really trying to advocate for access so that more people have access to transplant and don't miss their opportunity. So that's the end of the slides. And I will go back to all of you guys who are and get started with our panel for the evening. So up first, we have Jacqueline and Liam and a little friend that is joining them tonight. So we'll turn it right over to you guys to share a little bit about your story.
Thank you. This is Luca. He might speak over us a lot early. It's not even a teenager. So I'm Jackie. I'm the recipient, and this is Liam, who's my donor. So I am a diabetic also, as well as a kidney recipient. I was a diabetic. I was diagnosed at 7, so I've been a diabetic for almost 30 years now. And what was kind of shocking about my diagnosis, I got really sick and I was retaining water, and everyone kept telling me that it was my blood pressure. And so I was on a ton of medication for my blood pressure until finally my mom was like, this isn't right. I was so swollen. She took me to the ER, and almost immediately they realized that there was still something wrong. They weren't sure if it was kidney or heart. So I was checked in, and my kidney function had plummeted in a way that's totally anomalous to typical diabetic nephropathy. It went from being totally fine in July, and then by October, I had maybe 40% kidney function left. So that was difficult. I was just in my early 30 when we found out that my kidney was failing, and that posed a lot of questions for my husband and I. We knew we wanted to have a baby, and with my kidney functioning, barely functioning, that really helped push up this decision for us. So I'm also one of those lucky type O blood types. So there was no way like I was going to be too far down on that wait list. I wasn't on dialysis, so we were a preemptive kidney transplant. And when we found out I was type O, it was kind of a big shock because, well, shock is a weird term. I'm the only one in my family that's type O. My mom is type A, my dad is type B, my brother is AB, so I'm the one that's the O. Because AO, BO, we all split apart the genetic traits there. And so nobody in my immediate family, none of my cousins or anything were type O. And then Liam didn't know what his blood type was at the time. And it was stressful, really stressful, because I felt really unsure about asking people for to even get tested. I was really uncomfortable with the situation. And then for Christmas that year, Liam actually went and gave blood, and then we found out that he was a type O and he was my match. So I guess I picked the right husband. And yeah, so from there we went through the full workup, and this was right in the middle of COVID. So we were given our transplant date, and it was very Liam will talk to his experience as being the donor, but being the recipient of it, I found it like very difficult to enter into the surgery, knowing that it was my husband who was lying on the table next to me. And a large part of me was hesitant to enter into the living donor program because I wasn't comfortable with anyone making that sacrifice for me. Because it is such any surgery is risky, but I just couldn't, I don't think I fully was like breathing okay until our recovery, and I knew he was fine and everything was fine, because it was a lot for him to give to me and a lot for me to take from him. But through it, Liam just said how much he loved me, and then he was doing this for us. And as a result of this incredible generosity, we have this guy who was born just over a year ago, 2 years after my transplant. So
yeah, I mean, we talked about it kind of just recently, and kind of about how it maybe has affected our relationship. We don't really think it has. I don't think I realized how much pressure Jack felt about receiving it until we started talking about it the last few weeks. But I don't miss it. Wouldn't change my decision. And I think that I mean that we were at UHN, and I'm sure the other places are the same. But the teams were just amazing. You know, they spent so much time, you know, really examining me every single test to make sure that I was healthy enough to give up the kidney. And I think because of our age, they were even more thorough with that. So we always felt like we were in really good hands. I think even throughout recovery and everything.
Yeah, we had I had Dr. Cherney at Toronto General, and then Dr. Seltzner at Toronto General was our surgeon in the end, and they were both just fantastic supporters. Dr. Cherney was a big advocate to get the surgery done for us, just so we had a chance to have this little monster. So I think the recovery process was interesting because we didn't have kids or anything, so it made it a little bit easier. My mom came and stayed with us for a few days, and we didn't have anyone really to focus on but ourselves in recovery. And it was, in a weird way, like a nice, almost a vacation where we could really reconnect and spend that time together and just come to grips with what we had just been through as a couple.
Yeah, I guess that I think that kind of wraps up our story. We're happy to answer questions later on, I guess. But thanks for listening.
No, thank you guys. It's a really amazing story, and we were also thrilled to see your little guy. Thanks for having him join you tonight.
He really wanted to talk, so.
Well, next time we'll let him talk. But he's very sweet, and we'd love to hear such a positive story like that. And I think, Jacqueline sharing her reluctance, for you to go through this is a common thing that we hear from a lot of recipients. And what you said about, how thorough the testing is and how you felt, that your team wouldn't be letting you do it if they felt there was any risk. I think that's a really important message. So thank you so much for sharing that. We will, hold questions until the end. We'll go over to Willie and Nettie, who are up next.
Hello, good evening. We are Willie, and this is my wife. She's the donor. I was a recipient. This is Nettie. This happened about in 2017 when I went into kidney failure. I was born with polycystic kidney disease. For those that don't know what PKD means, it's just growth in your kidneys that eventually take over all your good nephrons, and next thing you know, you're in kidney failure. So when I got into kidney failure, I ended up in dialysis. The only reason why I had to do that was because my kidneys had grown to such a large size that a preemptive transplant was not going to work. I had no room in my abdomen. So when I did go on dialysis, they waited about a month to make sure that the dialysis was working fine. The dialysis was working fine. So a month later, I had a kidney removed to make room for the upcoming transplant. So I waited, and then finally that did happen. I had the surgery, and the kidney weighed about 15 pounds. So in the meantime, I had to look for a donor. I was in dialysis for 8 months. I did find a donor. It was my brother, but things just didn't work out with him. So I had to look again. And Nettie, she will tell you how she ended up being my donor, my potential donor at the time. And she'll tell you what happened during that process also. But for me, the workup was really, it was short for myself. I was always healthy, so there wasn't a whole lot of complications except for the PKD. My dialysis went well. And then afterwards, when I had the surgery also went well. I think the hardest thing was for when I had my nephrectomy. My nephrectomy was the worst. It was just so hard to get that big, cavern, that big object out of my body. And I did recover from that. It took a little bit. And then when I had the transplant, the recovery was pretty good on that too. But yeah, overall, it was good until the very end, 2 weeks before our surgery, and Nettie will fill you in on all of that.
Okay, so how did I become Willie's donor? It all started when the doctor told Willie his brother wouldn't be able to do it. So then I thought to myself, let me get checked out. In the meantime, this happened before our appointment. So I got checked out by donating blood. That's the only way I could do it. So when his brother failed, Willie says to the doctor, Nettie's an O positive. Okay, fine. Nettie, would you be willing to donate? What could I say? Yes, of course I would, because it meant a better life for both of us. So on with all the testing, 8 months of testing. We were a perfect match all along till 2 weeks before our appointment, our transplant. Then the doctor tells Willie, no, it's not going to happen because he had antibodies that were attacking my white blood cells. So that got ruled out. I got called into another room by my nephrologist, so thanks. And he asked me if I would still consider doing it. Well, of course I would, because or else he's not going to get anywhere in life either. So I did, and that's the way it went, right till surgery.
So we ended up going to the pair exchange, and it was a good thing for the pair exchange. I think it's such a great program especially for us. I mean, it gave us a second chance of getting a transplant, and she could still donate, just not directly, but indirectly to me. I still tell people that she was the one that donated to me, but yeah, it was just a great program. And now our lease on life is just so beautiful. I don't think it really changed our relationship that much. I think we're just happy with each other. She's happy that I'm healthy now, and I'm happy that she did what she did. And it just, our life today is just beautiful. Like Boxing Day again, this will be the third time after I had my transplant. We're off to Australia again to visit our daughter. Our daughter also has PKD, so yeah, it's nice to visit with her. And we'll stay there for the whole winter and come back when the sun's shining here. So yeah, it is a beautiful thing. I never ever thought in my life while I was growing up that I would end up where I am today. And even for the Transplant Ambassador Program, I think it's great that we can share our stories, and hopefully this story will help even just one person. It'd be great.
I just want to say that when we found out that I was not a match for Willie, we didn't know anything of the pair exchange. We were not talked about that because we were a perfect match all along. So when doctor told us I couldn't donate to Willie, it's like, what's going through your mind? So for those who don't know what the paired exchange is, going through kidney transplant, I hope you get knowledge on that too, because it was a tough go. But when we found out, it was great. It was not a letdown at all anymore. So that day we had 4 transplants instead of 1 transplant because of this paired exchange.
That's
Thank you.
amazing. Thank you, Willie and Nettie, for sharing your story. I understood, you didn't mention it, but I think that you really went through paired donor exchange very quickly, right? The whole process. How long did that take?
We did. We were supposed to go in for surgery on December the 8th, and we ended up going February the 1st. So 2 months later, and they had us paired, and the whole system. We had all this done at St. Joe's in Hamilton, and kudos to them. It was great.
They worked really hard for it, because she called us up at 10 o'clock last night, or that night, our coordinator. And I said, what are you still doing at the hospital? Because I knew she started at 8 in the morning. And she says, I have to make it work. So they worked pretty well around the clock, because they had a donor for Willie right away. And a little while later, not long at all, they had one for mine. So yeah, 2 months later, and it was done.
Yeah, it's an amazing story. Thank you. And even what you said about sharing, not knowing your blood type, and giving blood to find out. We do hear from a lot of people who don't know their blood type, and that's sometimes what we suggest too is go give blood, and you could find out, because oftentimes it's
What
not
my
in the medical.
family doctor
Yeah.
told me.
Yeah, exactly. Well, that's amazing. Thank you so much for sharing your story. We really appreciate it. We're going to go over next to Jim and Lynanne.
Hi there, I'm Jim. This is my wife, Lynanne. I'm the donor. Obviously, my wife then is the recipient. We live in Cherry Valley, just south of Belleville. Our transplant took place in Kingston. We're about an hour and 15, hour and 30 minutes away. Like the previous guests, my wife has polycystic kidneys. Our daughter also has polycystic kidneys. It meant that I forget the first guest's name. Unlike Liam and Jacqueline, where Jackie was concerned about taking her husband's kidney, my concern was whether or not I should be donating to my wife or holding off in case my daughter needed it. So that took a little bit of struggle in my own head, but we figured that out fairly easily. I was more than happy to donate, and we had been made aware of the paired kidney donor program. So right from the beginning, I was open to if we weren't a match. In fact, I didn't expect to be a match. I thought we'd be going through the paired donor program. It came as a surprise to both of us that we were a match, and the program that Kingston ran, which was new for them, has been a blessing for us. I'll let Lynanne take over, and if there's anything else I can add in, I will.
Yeah, it's been a really interesting. We had our transplant in June of 17, so we are 7 years in. And when I look back on it now, it's like we forget that there was a transplant. We're very supportive of the program. Our workup started in the fall of 16, so it was about a 9-month workup and waiting for the actual surgery date. As Jim said, I thought we were going to go paired. And obviously we had to go through all of the tests prior, and it wasn't until the end, as we were getting closer to finishing, that we realized that we were a really good match, which I think is amazing. I do have polycystic kidneys. I found out when I was pregnant with our second daughter on my second pregnancy. They discovered it in her before they discovered it in me. So the good news is from birth, she's been doctored, and there's so many more possibilities right now. We didn't really have any concerns. We were headstrong right into the transplant. Both of us are self-employed, so we have we kept going to our coordinators and saying, "What's the next step? What's the next step?" We just wanted to get to that part of it. The interesting thing that I will tell you is, as we were finalizing our actual tests and stuff, we knew that we were working towards, and we really wanted to have transplant in the summer. And I had gone away with a weekend with my girlfriends, and I came home, and Jim had gotten a phone call that team number 2 had backed out for whatever reason. We weren't privileged to that, and we had surgery in 10 days. And were we willing to hop through all of the extra tests to get it done and organize everything? It took us about 10 seconds to decide yes. And I think that whatever your doctors are encouraging you to do it. They're there with your best interest. And just like the other couple, there's a lot of background things that had to happen in order for that to happen in 10 days. So that was pretty good. Our relationship is good. The only thing I will say is Jim now has about 1 billion brownie points. So if ever I am mad at him, like earlier this evening, all he does is hold his kidney area, and I just stop. There's no arguing at that point. I can't say anything. So
It's a get out of jail card free.
Yeah, absolutely. We're both doing very well. And I'm excited that this process of kidney transplant has moved forward so beautifully. it's like buying a red car. When you buy a red car, everybody has bought a red car. So when we watch TV shows right now, kidney transplants are on everywhere. It's on the radar. And the most important thing, and I can appreciate this only after having a transplant 7 years ago, is you need to be public with it. You need to get comfortable with it, and you need to share it. We were private. We didn't want to tell anybody except our immediate family. However, when the time came about 4 months out from surgery, to release it to our friends and close people around us, I sent an email because I couldn't speak. And within 30 minutes, 2 people called me and wanted to offer to donate. So it's really important that you share that, because people want to help. And that's the amazing part. And just say yes to everything. If someone offers to come clean your bathroom, just say yes. That would be appreciated. It's a hard thing to say yes, but this program is amazing. And I find that the more questions you ask, the better it is. Our team in Kingston did a really good job. They didn't try to overwhelm me. They knew when I had asked enough questions that my eyes would kind of glaze over a bit, and they knew to just sort of quiet things down so I could digest a few things. But it is a really good process. I'm thankful for Jim being able to donate. And just like the other couples and people on here, it's just been a pleasure to see all the success stories. Thank you.
Thank you, guys. I had 2 quick questions. How did you manage your recovery together? Do you have any tips on that?
Yeah, that's where you need to say yes to everything.
Good.
So our kids are
makes sense.
growing. Yeah, our kids are growing. And so what they would do is come down on weekends and take care of us. And we did have some very good neighbors. So providing meals for us, they paid for housekeepers to come in and clean. And that seemed a little uncomfortable, but say yes. That's the important part.
Lynanne actually had her recovery was a little bit delayed. She has some issues. It's not something you wish your partner to have to go through, but in our case, it actually worked out, I think, for the best. Our daughters in Montreal, our sons in Barrie, they had to take turns coming down, taking some time off work. I was able to have basically a week at home while I was recovering, before Lynanne was able to come home. But by the time she was able to come home and our kids had to go back to work, I was able to get up and function and took over most of the care. But like Lynanne says, the more you let people know what you're going through, the more people are going to offer to help. So take advantage of that.
Yeah, no, that's great advice. My second question, and you don't have to answer if you don't want, but you mentioned that you didn't, you were unsure as to whether you should be donating to Lynanne or waiting until to see if your daughter needed it. And you said that you worked through that. I just wondered if you would share a bit more about how you did that.
Partly with the help of the intake nurse at KGH. But ultimately what it was someone telling me that you can't be sure what's going to happen. So my wife needed a kidney now. Our daughter was being looked after. She was young and healthy. There's no guarantee that if I waited that my kidney would have worked for her. But we knew that my kidney probably would work for Lynanne, or that we could at least go through the paired exchange. So my end process was the person needs it now. The paired exchange exists. If our daughter needs it, something will show up.
Yeah, that's amazing. Yeah, no, that's great. That's great rationale. Thank you for sharing that. Thank you both for sharing your story. We really appreciate it. I will be putting everybody's emails in the chat in a minute. So if you do want to reach out to anybody, you'll have their emails. Okay. So we're ready to move on to our next lovely couple, which is Mike and Beth.
Well, good evening, everybody. My name is Mike, and I am the very lucky recipient of Beth's donated kidney. And our journey, or rather my journey, started in 2017 when I was living in Washington, D.C., and I was hospitalized for an episode of malignant hypertension. And it was during that hospitalization that I learned I had stage 3 kidney disease. And it was basically downhill from there in terms of progression of the disease. In 2018, I moved to Buffalo, New York for a new job, and I also happened to meet Beth in 2018. And against that backdrop of sort of meeting Beth and, a new job, new relationship, I learned in early 2019 that my GFR had dropped to around 12 or so, and that I would need imminently a transplant. And, I'll get right into the reluctance I felt. I mean, you could understand, I'm sure, many of you. I think we all, and all of my friends here have expressed stories, and you'll hear some others about reluctance to take a kidney from a loved one. Well, here I just met this person, and Beth, to her credit and given her just unbelievable generosity, jumped in basically immediately and said she wanted to donate. Now, at this point, I was living in Buffalo and Beth was living in Oakville. And I really felt like the US system is a little bit different. Although it's still hard to get a transplant, it doesn't always take as long from a deceased donor. I kind of assumed, well, let's kind of see how things work out. And I learned sort of through my process that for various reasons, a living donor has a much more favorable prognosis, much more favorable outcomes than a deceased donor kidney. So if you're lucky enough to have somebody who wants to donate, and you can sort of manage the emotion that goes with that, that's definitely the way to go. But it was definitely kind of a winding process, and we started our workup in mid 2019, and this was against the backdrop of getting engaged right around the same time. We ended up getting married in October of 2019, and then in 2020, COVID comes along and sort of messes everything up. So we had a little bit of period of ambivalence about going ahead with the living donation at the same time as COVID was heating up, and then we just decided basically let's go ahead and do it. Our transplant was scheduled for March 2020, which of course probably one of the worst possible times to schedule a transplant. So ultimately that was canceled, and my transplant ultimately took place in the U.S. in Buffalo at Erie County Medical Center in July of 2020. So we had maybe a little bit longer process than usual, getting from decision to work up to donation. And I do want to point to one of our great friends tonight, who's also on this call, Joe, who will speak a little bit. And he was absolutely instrumental, given the challenges we were facing, of sort of convincing both Beth and me that this was something that was feasible, and that was something that was, a good idea and something we should at least seriously consider. So I want to thank Joe again for that. And Beth will also talk a little bit about her experiences with TAP and with Joe and with the process. But I think the sort of the main takeaway for us during this process is, in echoing some things that some of our friends have said, someone loves you, someone wants to make this commitment. It's actually better if you can kind of figure out how to get comfortable with it, because otherwise, you are going to delay the process. Your health is going to get worse. And ultimately, it doesn't really help anybody. to sort of delay things past the point where you have a path forward. And I think thinking through everything that goes into what that path forward looks like is much better than sort of standing around thinking of all of the reasons not to do it.
Yes. So I will say Mike is being too generous in what he was saying. The truth is I was actually very conflicted about donating. And we had a really sort of difficult process. And in terms of deciding whether I should donate or not, we actually started my workup, then we stopped it, and he went on the deceased donor list. Then when he became really ill and they were talking about dialysis, that's when we started talking about it again. So it was a really stressful process for us. It was described to us in the beginning as a roller coaster, and it certainly was for us.
Yeah.
There was a lot of downs and a few ups. So it was a hard year and a half. But I will say that I think our relationship is definitely stronger for having gone through it. It was this crazy, unique experience to have gone through together, and this bonding experience that we still have today, we still talk about. And so it's really, it was difficult, and now it's sort of this beautiful thing. But what was critical to us, which Mike already touched on, was talking to other recipients and donors. And we just would have continued to lose more time had we not done that. And we were lucky enough to be connected to TAP early in the process. And we talked to a couple of ambassadors. And like Mike said, Joe and his lovely wife, Joyce, who you will hear from later, they were the keys for us. And I've said it before, and it's still true. If it wasn't for Joe, I would never have found the courage to donate. That was just not going to happen without him. And it was absolutely the right decision for us. And I knew that the day after our surgery, when I saw Mike and he was healthier than I'd ever seen him, and still now, where he's, continuing to be healthy and continuing to get healthier, and both of our kidney function continue to improve. So we are so happy to be here tonight, and thank you for listening.
Well, thank you guys for sharing your story. It is really an incredible story, and we really appreciate it. How did you guys, I just have to ask you, how did you manage? Well, I think that, before I ask the question, I think that Lynn Ann's comment about say yes to everything is quite apropos in this story, but also.
Well, we would have if we could have. Let me just say it that way, because imagine, and I hope nobody here is in the circumstance, doing a cross-border type of donation is challenging enough as it is. But imagine being separated by the border during COVID. The border was closed for much of the time, and although they had some exceptions that allowed us to go back and forth for medical care, it wasn't easy. And partially for that reason, I have 4 kids, all of whom are grown. Beth is very close to her parents, and those people couldn't easily access us. So, when we got discharged from the hospital, we were largely on our own. And that just kind of added to the challenge of it. And we managed, but that's not something anybody should try to do, for sure. Right after surgery, it's kind of the last thing you want to do is to be, running around preparing meals and that type of thing. It's hard enough just to get in and out of bed.
Yeah, you guys are very brave, and like you say, it's hard to say yes to everything when you're not allowed to be around anyone. So good for you guys. You did an amazing job, and so glad to hear your story today.
Thank you.
Okay, so we only have a couple of speakers left, which, hey, a good segue over. You were talking about Joe and Joyce, so we're going to go over to them next.
Hi, everybody. I'm Joe. That's Joyce. Common theme tonight is polycystic kidney disease, because that's what I inherited from my mom. I found out in the early 90s that she she actually found out she got it when she broke her finger making a bed. So I have 5 siblings. We all went and got tested. Turned out 3 of us had it, 3 of us didn't. So my youngest brother, who didn't have it, offered to be the donor for whoever needed it first. And unfortunately, I was that guy. So my kidneys started to fail in when I was around 40. And I went to the kidney clinic and we started doing testing in late 2012. And my brother was going to donate. He got ruled out. So that was a huge letdown, one of the roller coaster rides, like Mike mentioned. What happened then was Joyce and I were sitting around going, okay, what do we do next? She said, why don't I get tested? And it was like, okay, what blood type are you? She said, I don't know. So first thing we did was get a blood test. Turned out we were the exact same blood type, so which was awesome. We went to St. Mike. Well, we called St. Mike's down in Toronto and said, hey, she's willing to get tested. Can we do it? And they said yes. So that started in January of 2013. And then on May 28th, we were down in Bahamas for our 25th wedding anniversary. And we got an email saying that she's a match and she could do it. So it was pretty awesome. It was a good gift for us. But they said it's not going to happen until December. So the problem with that was between May and December, it was a bit of a nightmare in that you didn't want to get sick. That was the worst thing that could happen. My mom had been on the deceased donor list for her PKD. She had been on dialysis and she got called to St. Mike's one night. We all rushed down there thinking she's getting a kidney. They did a test and she had some sort of urinary tract infection and said, go home. So we wanted to make sure we could stay healthy as long as we could and as well as we could. This was way before COVID and masks and social distancing and all that stuff. So that was the hardest part pre-transplant. Now we knew that we wanted to do some planning because we needed meals and things like that. We had Joyce's mom living with us who was in her 80s and we wanted to take care of her as well. But we got our transplant date, we went down to the hospital, went through surgery, everything was great. Our kids were there. And then we got home and started healing up. The hardest part was for Joyce to kind of relax beside me in our recliners because she's Italian and likes to do things and is a little bit stubborn, but I had to say that. So we healed up great. And it was after our transplant and when we had recovered, our kids said to us, and our kids at the time were 19 and 22, they said, you know what, we were really freaked out when both of you guys were under the knife. And we were like, we looked at it like we were shocked. We never even thought about that because our whole thought, or my whole thought process, and I think Joyce is going to say the same thing, was this is just part of our journey to get past this hurdle of having PKD, get a transplant, live a good life, be healthy, have our freedom. I was pre-dialysis, thank God. But we knew that if I didn't get a transplant, I was heading towards dialysis. And I really didn't want to do that because I saw what my mom had to deal with on that. So, so if you're going to have a transplant and you have kids, doesn't matter how old they are, please talk to them because they're going to be freaked out when both their parents are under the knife. I had no reluctance to accept the kidney from Joyce. Like I say, we've been a team for a long time. At that point, we had been together we'd been married for 25 years, together 28 years. And we just knew this was one hurdle to get over to have a great life like everybody else has said. So I don't know, do you want to say anything? Now, one thing I will say before Joyce starts talking, every time somebody has spoken here, I don't know if you noticed, she's been crying. And I'm very much an emotional person since I got my kidney. So I blame that on her kidney. So
he also talks with his hands, and that's part of the Italian in him now.
Very true.
Those are the funny things we talk about, but mostly I would just tell anybody I would do it over again with no hesitation. There are some mornings I wake up and I look at myself and I wonder, what is that? And then I remember that's where they removed my kidney. Yeah. I've had no setbacks. I'm on no medication. I take care of my family still. And It's been a really good life. Selfishly, I think maybe that's why I did it as well. I want to thank everybody for their stories and for Beth's recognition, because I was reluctant to be a TAP ambassador because I didn't think people wanted to hear our story, but I think people really do. And I want to just thank you for listening, and have a very Merry Christmas with your kidneys.
Thank you guys. What a great story. You do have a great story, and I know you've touched a lot of lives. And you know, hey, we consider you a transplant ambassador, Joyce. So don't worry about it. Just if you don't have a vest, we will. You know, we can rectify that. Okay. So thank you so much, guys. Appreciate that. Great story. I'm going to go next to Bill. Bill, you're still here. Excellent.
I'm here, yes. I'm here, and I'm emotionally so engaged in the wonderful stories that I've heard. I apologize. My wife, Catherine, my donor, is unavailable tonight. So for the first time in my life, I will have to speak for her. I'm not sure how well that's going to go, but I'll do my best. I'm 66 years old. I'm Bill Armstrong. My wife, Catherine, and I reside in Huntsville, Ontario, on the borders of beautiful Algonquin Park. Catherine was born in Vancouver. I was born in Toronto. We lived in Toronto for years, and then we decided to move up to God's country, and it's been fantastic. My background as a kidney recipient, I was born with one kidney, a solitary kidney. And in around 2016, 2017, it became apparent that I would need some kind of intervention. And the one thing that terrified me the most when I would go to my nephrologist in Richmond Hill in those days was there was a big dialysis ward that I could look through the glass in as I walked onto the elevator with what I thought was a clean bill of health. And I thought to myself, that is the last place I want to go, is through those doors and have to sit there and do whatever you do. And so I sat down with my nephrologist, my third, and I said, is there such a thing as a preemptive procedure? And he went, yes, there is, but you have to be well enough to receive a kidney, and you have to be, you have to be a candidate for it. And so I guess the journey begins. But before I get into any more of the details of my life, I first of all, I want to thank Sue McKenzie profusely for her commitment to Transplant First, her love and her care for all of us. I think that needs to be acknowledged. And you're a tireless tigress, my dear. And you keep fighting the good fight. And I think it's super important. I also want to thank Joe for keeping me on track when I would go into the dialysis ward. Do you remember this, Joe? I go in a dialysis ward and I'd say, Joe, there's no one there that's being worked up. And he said, maybe they just want to talk to somebody. And that's exactly what they wanted. They just wanted someone to talk to. And I've had so many great experiences. It's just incredible that being a TAP ambassador has been very fulfilling for me emotionally. And it's not just about giving back. It's about as well feeding my soul. And so that's been very important to me. In terms of the workup, our workup it took about a year. My wife, Catherine, was my donor, and she has the universal donor blood type, which was incredible. And our workups took a little longer than they should have for various reasons. But our transplant was, I must say, uneventful. It was smooth and quite remarkable. Within 3 months of the transplant, we came up to our cottage and we built a small building together. I think it's what's kept us from, falling out is that we just build things together. We built our life together. The transplant is just is an element of that. And we came up here and discovered that because of her incredible gift to me, that we were going to get to build more buildings. And that's why we're here. A little shout out as well. I'm all over the place, so I'm just going to sort of navigate my way through these points here. Someone who is in the crowd tonight, who is a panelist, changed my life a lot, and he knows where I'm going with the story, and Sue has heard this story a lot. But when you're going through maybe a year before the transplant, at least for me, I was pretty scared. I was kind of terrified of the whole thing. So of course, what do I do as a Armstrong male? I just buried it. I just, ignored it, and I was oblivious to it. And then someone by the name of Van Dyke kept phoning me, and there was a phone call, and I'm like, who is this guy? The only Van Dyke I know is Dick Van Dyke, right? And then there's another call. And then the fourth call, I go, okay, who is this guy? I pick the phone up and I go, hello. And it's Willie. And remember, Willie, we had this, you talk to a lot of people, so do I, maybe you don't remember, but if you do, it was a great conversation. It was an hour and a half. And without you continuing to phone me, I'm not sure I would have had the gumption, the guts, the strength to do it, because I was, as I say, I was scared. The whole experience has been incredibly emotional for me, as you can see. But Joe, you touched on a point that I thought was fascinating about because you have your wife's kidney now, you've become emotional. Sorry, I think I got cut off there by the internet.
Yeah, you did get cut off. I thought I thought you cut yourself off or something, but no, sorry. We heard that you became emotional, and then we didn't hear anything else. Oh, I think he's frozen again.
And she sends her regards to Emma and everyone else listening out there. If I can speak for Catherine, a bit, her recovery was very fast. It hasn't affected her at all. And it's allowed us, and people have touched on this tonight, it's allowed Catherine and I to remain a couple, remain together, continue to do the things that we love to do together. Has it changed our relationship? I'm not sure that it has. I think that what it's done is it's allowed us to just realize how fortunate we are to have each other in our lives, and that, we're going to have more time together. So that's been amazing. In terms of as a TAP ambassador, my advice to, if you're a recipient and you're concerned about receiving a kidney from a family member, the data does not lie. Okay, the data is accurate, and the effect on the donor in terms of longevity it's insignificant, frankly. And we have to look at those numbers, right, Sue? We have to look at them because they're true. And the significance in terms of longevity of a living donor transplant is the gold standard for transplant in this country. And so it's really important that we keep our eyes on the data. And the other thing is, if you're being worked up, and people have touched on this tonight, do everything the doctor tells you to do. Okay, if they say you can only have, a couple of pieces of cheese a week, then that's all you can have, right? You have to do everything to the letter of the law that they tell you to do, because if you can hold on, like I did, my transplant was preemptive, so I was never on dialysis at all. I was very fortunate. So just basically, behave. Okay, it's very important that you do that, and it changes your life dramatically. And back to, I'll wrap this up, back to Joe's thing about being emotional now. I can now eat shrimp and lobster. And I couldn't before. And that's a really big deal for me because I love it. And that's our story.
Thank you, Bill. And I assume that eating shrimp and lobster makes you emotional, more emotional than it did before.
Oh, I cry whenever I have one of them. I just can't help myself.
Thank you. Thank you so much for sharing your story. It's always so great to hear it. And I think we have a lot of patients on the call tonight who I think will get a lot out of your story. But for us as transplant ambassadors, we get a lot out of it too, knowing that if we call 4 or 5 times, we might actually talk to somebody who we really can make a difference for, because we do find that a lot of people just kind of put off that conversation when it could actually be a really positive one. So thank you for sharing that. Really appreciate it. And we have one more panelist, and then we'll take questions. So we're actually doing really well for time. So Robin is joining us here from London, and her other half is not available. So I got to just find you, Robin. There you are.
Yep. Hi, everybody. My name is Robin Chaco. I live in London. I donated my kidney to my husband Leo back in September of 2020, right in the middle of COVID. Sorry he can't be with us this evening, so I'm going to be speaking on his behalf. Just a bit of background, just shortly after Leo and I got married, he did find out that he had polycystic kidney disease. His mom had polycystic kidney disease as well. So not only did I watch Leo through his journey with the disease, I watched his mother go through the same thing. So she ended up on dialysis for about 2 years, and then was fortunate enough to receive a deceased donor kidney. Watching her go through dialysis is great, but it took so much out of her. She would go for her treatment, and then she would just be flat out the following day, not able to do anything. So as Leo's disease progressed, it was, as he would describe it, it's like putting a frog in a pot. You have that energy level start to diminish slowly. So when we kind of knew it was time to either have a transplant or to go on dialysis, I stepped up and I said to Leo, why don't I get tested? We both knew we had the same blood type, O positive. So I reached out to the living donor program here in London. Met with Christy, my coordinator, who was fantastic. And then we started the workup. So I was doing my workup, Leo was doing his workup. It was between 6 and 8 months. And just a little caveat, I hate needles. I hate being in the hospital. It's like, was the worst thing ever. But I felt I had to do this, and I wanted to do this for Leo. So went through all of the blood work, all of the tests and stuff. All those tests are basically to make sure that I was healthy enough to donate my kidney to Leo. So it would not impede my health at all to donate to Leo. And I was fine with all those tests. So as we were getting closer and waiting to get that call to confirm that I could be a donor to Leo, just getting anxious. And of course, Leo was getting more and more tired. As Willie had mentioned, Leo's kidneys became extremely enlarged. So when he was talking to his surgical team, both of his kidneys had to come out during transplant. So anyway, I got the call from Christy when I was at work. I did a little dance. And so we got ready. Of course, in the middle of COVID, We had to do some extra precautions. So we were fortunate enough, my parents came from Nova Scotia to help us out. They had to quarantine with us a week before our surgery. So that was fine. That all worked out. We had surgery, and then we did our recovery. My parents were here. We're also big planners, so we filled our freezer with lots of food. They helped us with laundry and a little bit of cleaning, so they were with us for about a month, which was awesome. After surgery, just watching and looking at Leo, it was just a totally different person. I got my husband back. It was like when we first got married. His energy level was up. His stamina was, it was just amazing. Just the change within those first few weeks. It was incredible. I'm healthy. I wasn't on any medication prior to surgery. I'm not on any medication now. And relationship wise, we're pretty much the same. We're very open communicators. So through the whole process, I would meet with my coordinator, Leo would meet with his coordinator, and then we go, basically it's like, okay, what did you find out today? All right, and then we'd share that. And what did you find out today? So our communication has always been open, and I have a lot of people say, oh, you've done such a selfless thing. I'm like, no, I was selfish because I want my husband around for as long as possible. So, and that's our story.
Thank you, Robin. That's amazing. I think Leo would be very happy with your rendition of the story. And thank you so much. We
Thank you.
will that's the end of our panel. And so I am going to stop the recording so that we can take some question and answer.